needs to be looking at the things he's going to do to maintain absence. For example, he's going to participate in outpatient treatment. He's going to probably get him a sponsor. He's probably going to attend some 12-step meetings or celebrate recovery, or may go to church, or anything that's going to be supportive to him during this process that's going to help him to remain absent. He may want to submit drug screens. Those are methods that can be used to for him to be able to achieve that goal. And then, you got to have a time frame on it. Let's look at it for 1 month, and see how things go. And then you could go back and discuss it with the client, see where he's at with that goal. Remember, identifying and ranking. And we're looking at a short-term goal versus long-term goals. Some things like the drug use, we want to kind of get that under control right away. So the client may want to go back to school and obtain an associate degree or bachelor's degree or master's degree. And that could be long-term. And so you would discuss ways that he could achieve that goal. That's identifying methods and resources that may be available that can help client through this process. There's a lot of resources that's out there that can be supportive to the client, and even the probation officer could be supportive, or DSS could be supportive. So you have to share the treatment plan with the client support system, and the client should be given a copy of the treatment plan or the person-centered plan. He needs to know the goals, and he needs to know ways of how he's going to achieve that goal. He needs to be able to look at it every day to know what he's working on, to see whether or not if he's making any progress or not. And if the goal is not working for him, then maybe he wants to switch up and try something else. And so, which leads into counseling. Okay, so counseling, we're talking about counseling. We could be talking about individual counseling. We could be talking about group counseling. We could be talking about counseling with significant others. We could be talking about marriage counseling. So just keep that in mind. It's not just substance abuse counseling. It's and then there are 7 global criteria to counseling. So there's going to be a lot of questions on the exam that's centered around counseling, whether talking about the different counseling theories. At least be familiar with at least 3 or 4, or maybe even take heed to some of the ones that you prefer. For example, I may use RBT, which is rational behavioral therapy, or cognitive behavioral therapy, or motivational interviewing, or solution-focused therapy, or client-centered therapy. So you want to be familiar with those, the techniques, the different skills, the knowledge that you need to have about those different theories, and the techniques that you're going to use to assist the client with being able to reach his goals or to participate in group. Some of the skills that's needed. A lot of time we expect clients to come to group and know automatically what they're supposed to do. However, that's not realistic, because some of the clients that we get today never experienced group therapy. So we have to explain it to the clients. We have to inform them of the important information of what it is. And then individual counseling, to be able to meet with that client, to be able to identify with that client, to be able to understand his culture, where he comes from, his likes and his dislikes, the different behaviors, his attitude, how he feels about different things. You want to be able to explore that in individual or group counseling. You want to be able to be tentative to that client. You want to be able to keep in mind that you started building that rapport at the beginning during the screening process. This is a continuation of its treatment, of building that relationship. You want to be able to interact with that consumer in a positive manner, an appropriate manner. So you want to be mindful with the language that you use with this individual. You are not his friend. You are not equal to him. However, you are the counselor and he is the client. And you always want to keep that in this perspective. You are not his friend. You are here to help him. And you want to always be in that professional role when interacting with the client. And counseling is not about you doing all the talking. Counseling is about soliciting ideals and solutions from the client.